Hi guys, so let's start today your acid-base balance. Today marami tayong matututunan, so come with me. So class, to achieve your homeostasis in the body, your pH should be within this range, 7.35 to 7.45. So class, wag niyong kakalimutan yung range na yan, 7.35 to 7.45, ang normal na pH natin. So class, your body is hard at work to maintain that small range of pH. Yan. So, to prevent acidosis, to prevent alkalosis, yan, there are different mechanisms in the body wherein your body is hard at work, class, to balance it out. So, we have different buffer systems for that. So, buffer systems, class, prevent harsh or abrupt changes in your pH. So class, we have these three. Yan. So yung pag-aaralan natin, class, yung lungs at kidney, napakahalaga nan sa acid-base balance natin. So class, just a review, isn't it that your pH means power of hydrogen? Yan. So class, more hydrogen ion inside your body makes you more acidic. Yan. So, more hydroxide ion, yung OH negative class, makes your body more alkaline. Yan. So, kung saan napupunta tong hydrogen ion could determine what's your pH. Yan. So, your lung class is important because it exhales, or it's the one that's in charge with regulating your carbon dioxide. Class, more carbon dioxide inside your body makes your body more acidic. Why? Because it participates in the production of carbonic acid, H2CO3. Yan. So class, by exhaling your carbon dioxide, you lessen the acidity of your body. Yan. So your lungs, class, is very important in regulating your carbon dioxide. So sa ABG natin, class, arterial blood gas test, is we also measure the carbon dioxide, because more carbon dioxide in the body, guys, is it becomes more acidic, and lesser carbon dioxide, more carbon dioxide that are exhaled, yan, in the body, makes your body more alkali. Yan. So yan ang role ng lungs. Regulates your carbon dioxide. Next class, your kidneys. Your kidneys now regulate your hydrogen ion. Yan. So more hydrogen ion inside the body makes your body more acidic. So once your kidneys release more hydrogen ion, guys, in your urine, then you will be more alkaline. Yeah. And class, we have other buffer systems, which are your protein. Class, ang mga protein may charges rin yan. Protein buffer system, carbonic acid, bicarbonate system, and phosphate buffer system. So class, mag-focus tayo sa lungs and kidneys. So class, yun nga, pag there can be imbalances. So pH below 7.35 or actually close to 7.35 is kind of acidic. And your alkalosis is when your pH is beyond or above 7.45. So class, I've summarized my topic in a single table. I hope that, I know let's take our time in analyzing these ones. So class, meron tayong acid-base disturbances. Meron tayong respiratory acidosis, respiratory alkalosis, metabolic acidosis, and metabolic alkalosis. Yan. So, i-break down natin yung mga terms. Yan. So, when we say respiratory, so it's the we have two words, respiratory and metabolic. So, pag ginamit ang respiratory, the disease or the cause points out to the lungs. Yan. Pag sinabing metabolic, class, so the disease or the cause points to your kidney. Yan. So, there's something wrong. So, pag sabi natin respiratory acidosis, there's something wrong on how the lungs regulate your carbon dioxide. Pag metabolic acidosis, there's something wrong with how the kidneys regulate your hydrogen ion. So pag sinabi nating respiratory acidosis and respiratory alkalosis, ang may mali dito around the lungs area. And so there's something wrong with how the lungs regulate their carbon dioxide in changes. And when we talk about metabolic acidosis and metabolic alkalosis, there's something wrong with how the kidneys manage your hydrogen ion. Yan. Basic, simple, tama. So class, now let's explore. So na alam niyo na ha, respiratory, saka metabolic. So pa, respiratory, so there's something wrong with the lungs. There's something wrong how it regulates carbon dioxide. And metabolic, there's something wrong with the kidneys. And there's something wrong how it regulates your hydrogen ions. Okay. So class, so respiratory acidosis. What do you expect the pH would be? Yan. Metabolic acidosis. Ano ina-expect yung pH? Umaakyat o mababa? Diba? Decrease. Decrease, diba? Acidic eh. Less than 7.35. At pag respiratory alkalosis and metabolic alkalosis, mataas ang pH. Okay. Next class. Dito tayo. So, notice ha, yung reference range natin, 7.35 and 7.45. Now, class. So, now we're heading to partial pressure of carbon dioxide or PCO2. So, your PCO2 class is 35 to 45 millimeter mercury. Yan. So, as a clue class, kung ang pH natin 7.35 and 7.45, ang partial pressure of carbon dioxide natin is 35 to 45 millimeter mercury. Don't forget the unit, ha? So, kung pH natin 7.35 to 7.45, so our partial pressure of carbon dioxide is 35 to 45. So, hopefully, you won't forget that, okay? So, class, sino ang nagmamanage ng carbon dioxide? Are our respiratory or metabolic? Yan. Ma'am, respiratory. Yan, okay? So, if we have respiratory acidosis and respiratory alkalosis class, there's something wrong with your partial pressure of carbon dioxide. But for metabolic acidosis and metabolic alkalosis, expect it to be normal, ha? Walang pakialam ang kidney sa carbon dioxide, okay? So, if we're going to, yan, yun. So, dapat, class, pag uncompensated, so there's no, your body is not yet reacting to any changes in acid and base, class. Dapat ang metabolic acidosis and metabolic alkalosis, normal lang ang partial pressure of carbon dioxide, okay? Now, class, ang may iba dito, respiratory acidosis and respiratory alkalosis. Kanina, ano sinabi ko? Ang carbon dioxide, it makes your body more acidic or more alkaline? Diba? More acidic. Mas maraming carbon dioxide na nagre-retain sa katawan, class, mas acidic. So, therefore, in respiratory acidosis, guys, expect an increase of carbon dioxide because more carbon dioxide in the body will make your body more acidic. Yan. So, pag respiratory acidosis, guys, expect a increase of your carbon dioxide. In respiratory alkalosis, class, it has less carbon dioxide. Yan. At yung metabolic natin, yung dalawang metabolic natin, class, normal. Okay. Basic. And finally, bicarbonate. Yan. So, same thing, class, yung mga respiratory natin, diseases, walang pakialam sa bicarbonate, okay? So, expect the two to be normal. But what manages your bicarbonate, yan, is your kidney, yan. So, ma'am, kanina ang nabanggit mo lang hydrogen ion. Yes, yes, yes. But class, you know, your kidney also manages or secretes bicarbonate, yan. So, class, bicarbonate is basic, yan, is something very basic. So, excess bicarbonate in the kidneys or in the body, basic siya. So, mas marami. So, alkaline. So, your body will become alkaline if there is excess bicarbonate inside your body. Yan. And metabolic for acidosis, yan, there is loss or excess loss or excretion of bicarbonate. Yan. So, tignan natin ha. So, sa mga respiratory diseases natin, expect that both will have normal levels of bicarbonate in cases there is uncompensated respiratory acidosis and alkalosis, and expect sa metabolic acidosis, increase or decrease ang bicarbonate. Bicarbonate class basic. So, decreased. Diba? Tapos, pag metabolic alkalosis, expect an increase of bicarbonate. Yan. So, class, so that perhaps you could use this. Yan. So, we have this mnemonic Rome. Yan. So, pag respiratory, expect ang pH at PCO2 are in opposite direction. So, kung acidosis, pababa ang pH, pataas ang carbon dioxide. Alkalosis, mataas ang pH, mababa ang carbon dioxide. Notice? Yan. Rome, respiratory, opposite. Next class, for metabolic acidosis, expect your pH and your bicarbonate to go to pointing to the same or equal direction. Parehong pababa. And your metabolic alkalosis, parehong pataas. Tada! Yan. So, aralin niyo na. So, normal po ang PCO2 sa metabolic kasi walang pakialam sa pag-manage ang kidneys ng carbon dioxide. Normal naman ang bicarbonate pag respiratory. Okay? So now, class, paano tayo palalim ng palalim? So class, so respiratory acidosis, ano yung cause? Yan. Sabi ko sa inyo na nare-retain ang carbon dioxide pag respiratory acidosis. So there are cases. So here, the condition of respiratory acidosis class are conditions which affect your respiration. Yan. You do not have the ability to exhale carbon dioxide. That's why you retain so much carbon dioxide. So what could be the cases? We have emphysema, pulmonary edema, airway obstruction. So may nakabara. We have COPD, chronic obstructive pulmonary disease, pneumonia. So this person has the inability to exhale carbon dioxide. Hence, that person retains more carbon dioxide, hence the body becomes more acidic. Yan. So yan, causes muna tayo, class. Next class, respiratory or compensatory mechanism na tayo. So class, your body, if it experiences respiratory acidosis, it does not stop there. Yan. So if there's something wrong with your lungs, class, your kidneys will kick into action, kick into action. So meaning kung may something wrong with the lungs, andyan ang kidney na sosuporta. Ayan, andyan ang kidney. Ewan ko saan ako nakahawak, class, andyan sa likod. Andyan ang kidney na susuporta pag may respiratory acidosis. So class, as a compensatory mechanism, since there's something wrong with your lungs, there will be renal compensation. Your kidney will kick back into action. Yun. So class, sabihin natin, kunyari, ikaw, you're discouraged. And, and sinabi mo sa friend mo, friend, I'm so discouraged now. Your friend is activated. Now, your friend will encourage you. Or yan, pag kunyari, mahina ka, sila ang yung kalakasan. Diba? Parang ganun ba? So, what will the kidney do? The kidney will excrete hydrogen ion in your urine. Yan. Para mabawasan ang pagiging acidic ni lungs kasi hindi siya masyadong makahinga at maka-exhale ng carbon dioxide. Now, your kidney will be activated to excrete your hydrogen ion in urine. Yan. So, your kidney will compensate yan, for the inadequacy of your lungs. Ang galing ng katawan, guys, diba? So, class, meron ako ditong mga naka-asterisk. Yan, mga asterisk. These are your medical support. So, this can be done by your doctors. So, yung malaking dito, excretion of hydrogen ion. So, that's the function of your kidneys, of your body. Yung naka-asterisk, class, this can be your treatment in the hospitals. So, class, aside from the excretion of hydrogen ion in urine, we can help our patients with respiratory acidosis through ventilation. Yan, through ventilation by using a mechanical ventilator, or meron naman tayong non-invasive ventilators, yan, to help the patient exhale carbon dioxide and breathe in oxygen. Okay? So, what are the compensatory mechanisms for respiratory acidosis? Your kidney kicks into action by excretion of hydrogen ion, and the doctors can perform ventilation to the patient, yan, or attach the patient to a ventilator so that, to facilitate the exhalation of carbon dioxide. Okay, next class. Respiratory alkalosis. Yan. So here, what's happening is the patient is losing more carbon dioxide. The patient is low in carbon dioxide. Example, when the person is hyperventilating. When the person is hyperventilating, kailan ba ang nag-hyperventilate ang isang tao? Pwedeng there is severe anxiety, panic attack, they are in pain. So when you're hyperventilating, class, you're losing so much carbon dioxide. Yan. So a first aid, if you're losing more carbon dioxide, yun, sa mga anxiety attack, pain, yan. So you can get a paper bag and blow into it. Yan. So that you could return your carbon dioxide back to your body. Yan. So, yung mga nagpa-panic attack, ganyan. So, yun yung binibigyan natin sila ng bag. So, that's a first aid. At saka, yun, first aid thing that we could do so that to return the carbon dioxide back to that body. Yun yung class, my friend who is a heavy smoker, na 2 beses yun na ginawa to. Tinawagan, so he just came from a party, itong friend kong to. Tapos, 6 a.m. kakauwi niya lang daw. Tapos, biglang tatawagan niya ako, hindi daw siya makahinga. Yan. And he's hyperventilating. Yan. That's what he's saying. He was panicking already kasi nga, hindi siya makahinga. At ang rami daw niyang niyosi. Tapos sabi ko, friend, get a paper bag. Yan. And breathe into that paper bag. Tapos sabi niya, friend, wala, I don't have any paper bag. Yan. So I said, get a glass of water, doon ka huminga. Yan. Basta, kahit anong way para maisole ang carbon dioxide sa circulation. Ayun, ginamit naman niya yung glass of water. Pero si party boy, may tubig pala. Ayun, buti nga sa kanya. Diba? So, ayun. May tubig pala na tapunan siya, guys, ng tubig. Anyway, so that's what you can do if someone's hyperventilating. So if a hyperventilation is going for a long time, it can result to a respiratory alkalosis. Yan. And aside from breathing into the bag, yan, so your body, your kidney also compensates in a way of excreting hydrogen ion in your urine. Yan. Excretion of hydrogen ion in your urine. Since your body is being so alkaline already, sabi niya, magtanggal pa tayo ng something that is alkali, which is hydroxide. Yan, hydroxide ion. Yan, class. So, low carbon dioxide can be found in hyperventilation, people with pulmonary disease, psychogenic, class, nasa isip, severe anxiety, panic attack, pain. Class, apparently rin, pag isang tao nag-overdose sa aspirin, I don't think aspirin is very common here in the Philippines. We don't usually use aspirin here. But class, if someone drinks aspirin, class, excess aspirin or naglalason ng yung nagsusuicide sila gamit ang aspirin class. Your aspirin attacks the respiratory centers of your brain. It will activate or stimulate the respiratory centers in your brain, wherein it will promote respiratory alkalosis. So pag may respiratory, nagka-hyperventilate ka. Yan. So yung mga naglalason ng sarili, nag-overdose ng aspirin, nagka-hyperventilate sila, papanik na sila, ganyan. So one way is to breathe in into a paper bag. Class, we have a disclaimer for renal compensation. This happens after a day. Yan. So, yung kidney natin, nakikik into action after a day. Ang mabilis mag-feedback class yung lungs. So, dito tayo sa metabolic acidosis. So, di ba pag may metabolic acidosis, masyado tayong maraming hydrogen ion sa katawan o kaya masyadong naglo-lose ng bicarbonate in cases of severe diarrhea. Yan. So, you're losing so much bicarbonate if you have diarrhea. What else? Failure to excrete hydrogen ion. So, rumarami yung hydrogen ion mo, kaya nagkaka-metabolic acidosis ka in cases of renal failure. So, yung mga acute and chronic renal failure, may sira sa kidneys. What else? People who have excess acid in the body, just like people who have diabetic ketoacidosis. Ma'am, kailan nangyayari itong diabetic ketoacidosis? In cases wherein your diabetes is unmanaged or untreated, hindi ka gumagamit ng insulin. So yun, marami yung ketone sa katawan mo, which is acidic. Yan, excess acid. So yun, metabolic acidosis. So expect a decrease of bicarbonate and increase of hydrogen ion. What else? Lactic acidosis and renal failure. Yan, wherein you cannot excrete hydrogen ion. Yan. So class, kung bumibigay ang kidney, what will kick into action? Ano ang ma-activate? Ang lungs. Yan. So your lungs will compensate for the weakness of your kidney. Yan. So kung may metabolic acidosis ka, class, you will hyperventilate. Yan, you will hyperventilate. When you are hyperventilating, you are losing carbon dioxide. You are losing acid inside the body. Yan, okay. Diba? Kasi nga, pag maraming carbon dioxide, nag-compensate eh. So, metabolic acidosis ka na, acidic ka na. So, magkikick in sa action yung lungs mo. Sabi niya, I need to help. Sabi ng lungs, I need to help. I need to help the body to reduce acid. Anong gagawin niya? Magre-release siya ng carbon dioxide. And if not, class, sa hospital, we could administer IV sodium bicarbonate and correct the cause of acidosis. Kung may diabetic ketoacidosis yung patient, bigyan na natin ng insulin. Yan. Next class, metabolic alkalosis. Metabolic alkalosis. So your body is so alkaline, di ba? So how did that happen? Perhaps you were vomiting. Yan. So a night of drinking. Ang rami mong sinuka. Class, you have to be careful kasi baka ma-metabolic alkalosis ka, okay? Or in cases of excess bicarbonate, yan. People who are drinking antacid. Yung mga acidic ang stomach, yun naman, acidic, tapos sobrang rami namang nainom na antacid. Yun, it can result in metabolic alkalosis. When a person has been taking diuretics, especially dun sa mga may heart diseases, yan, nagda-diuretic sila. And severe hydration, yan, severe hydration. So, metabolic alkalosis. Yan. So, metabolic alkalosis, alkaline yung katawan mo, di ba? So, now, since there's something wrong with your metabolic alkalosis, yan, you have metabolic alkalosis, now your lungs will kick into action. Sabi ng lungs, hala, ang taas na ng pH natin, alkaline na tayo. So what would the lungs do? It will hypoventilate. Yan. It will retain more carbon dioxide so that to balance out the pH. Yan. So, ang galing ng class. So, pag metabolic alkalosis at acidosis, your lungs compensate. Okay? They kick into action. When you have respiratory acidosis and respiratory alkalosis, your kidneys will kick into action. Word for the day, kick and reaction. Okay. And class, so kung ayaw talaga madala sa hypoventilation ng lungs, yan. So in the hospital, yan, we could provide electrolyte therapy for people who have metabolic alkalosis. Class, I hope naintindihan nyo. Yan. Kung di nyo naintindihan, rewind na lang. Okay. Rewind. So let's try, class. Let's try assessing whether a person has respiratory acidosis or alkalosis or metabolic acidosis or alkalosis. Okay? So, example dito. A 24-year-old woman is found down in Burnham by some bystanders. The medics are called and upon arrival, find her with an oxygen saturation of 88% on room air and pinpoint pupils. Yan. She is brought into the SLU emergency room where an arterial blood gas is performed and reveals, yan. So class, yung pH niya, 7.25, carbon dioxide niya, 60, PO2 65, bicarbonate 26. Yan. So step 1, assess the pH. So get a pen and get a paper. 7.25, class, acidic or basic? Yan. Diba? Acidic. Next class, PCO2 60. Diba? Ang taas masyado. Yan. So assess your PCO2. And thirdly, assess your your bicarbonate 26. So meron ako dito reference range sa tabi, class. That's within normal range. Yan. So mababa ang pH, mataas ang PCO2 at normal ang bicarbonate. Diba meron tayong Rome? Respiratory goes to opposite direction. Metabolic goes to equal direction. Yan. So class, so pH is acidic. Tapos, nag-go ng different direction, yung PCO2 at saka yung pH. So, respiratory acidosis. Yan. So, class, I have this term, uncompensated. So, meaning your kidney is not yet kicking into action. Yun. To compensate. So, uncompensated respiratory acidosis. Okay? So class, meron tayong word na uncompensated, partial compensation, and full compensation or partial compensated, full compensated. Yan. So pag sabi natin, class, yan, notice sa respiratory acidosis, pag uncompensated, like kanina, mababang pH, mataas ang carbon dioxide, normal, pag ganito, normal ang bicarbonate. Class, pag partially compensated na unti-unti nang tumataas yung bicarbonate, mababa pa rin yung pH. So, acidic pa rin yung pasyente natin. Pero pag fully compensated na, pH is normal na. So, it's between 7.35 to 7.45. Mataas yung carbon dioxide at saka yung bicarbonate. Yan. So, you should observe well your pH. Yan. So, kung malayo sila sa normal value, sure na acidic, yan, sure na basic or alkaline. Pero pag malapit na sila sa normal value na parang hold up, pwede na tong compensated. Yan. So, yan, you have to read your problems carefully because it could also give a clue. Ito, try natin. Sa pa. Pero ito na to the next level na tayo ha. You have to say whether it's uncompensated, respiratory chuchu, metabolic chuchu, or partially compensated or fully compensated. Okay? So I'll give you more examples. So next is a 64-year-old with COPD. COPD, there's something wrong with the lungs. Oh, ano na yan? Was admitted to the ER with extreme shortness of breath. She had a bluish color that was particularly pronounced on her lips and nail beds, and she displayed a weak, persistent cough with diminished but rattling breath sounds. Home medications included bronchodilators, steroids, Lasix, and digitalis. Yung for the heart yun ah. Vital signs, heart rate, 148, blood pressure, 188, temperature, 37, respiratory, 838. Yan. So, initial blood gas results in room air were, so ito yung ano natin, blood gas results. So, pH, 7.289. So, that's very low, diba? Next, PCO2, 91. Class, ang taas ng PCO2 niya. Diba, 35 to 45 lang ang normal value. And bicarbonate, 43. Yung 43, 22 to 26. Kasi memorize yung mga normal value natin, ha? So, class, ilagay nyo sa papel nyo. So, step 1, assess the pH. So, mababa. So, acidosis yan. Next, assess the PCO2. So, kung equal sila or opposite. So, respiratory acidosis. Now, assess your bicarbonate, class. So, mataas na yung bicarbonate. Ibig sabihin, the kidney is now kicking into action or compensating. Yan, mataas na. So, since class, okay, we're back, guys. So, here we have partially, saan na yun? Partially compensated respiratory acidosis. Why, ma'am? Kung uncompensated respiratory acidosis to class, normal yung bicarbonate. Kung partially compensated respiratory acidosis, mataas ang bicarbonate. So class, kung fully compensated respiratory acidosis, normal yung pH. Okay, class? So here, it's the best answer, guys, is partially compensated respiratory acidosis. So, up, down, up, partially. So, ano? Down, up, up. Down, up, up. Oh, yan. Dito sa may table natin, down, up, up. Okay? So next, guys, a 64-year-old man is brought into the hospital with complaints of severe nausea and weakness. He has had problems with peptic ulcer, yan, in the past and have been having similar pain for the past 2 weeks. So class, peptic ulcer, parang metabolic, hindi lang problem. Other than that, see a physician about. Rather than see a physician about this, he opted to deal with the problem, self-medication, on his own. And over the past week, he has been drinking significant quantities of milk. Dahil may peptic ulcer siya, class. Your peptic ulcer can be very acidic in the stomach. Uminom siya ng milk and consuming large quantities of Tums, calcium carbonate. So class, Tums is a antacid. Clue. So on his initial laboratory studies, he have a calcium level of 11.5, CREA of 1.4, and a bicarbonate of 35. Yan. Sa serum glass. The resident in the ER decided to draw an arterial blood gas test, which reveals that your pH is 7.45. So actually, it's alkaline, but it's borderline alkaline. Normal siya, di ba? Normal, class. So, pag nagiging normal, di ba, fully compensated. PCO2 49, so mataas. pH bicarbonate 34. Yan. So, bicarbonate 22, so mataas rin. Yan. So, assess the pH. So, apparently, guys, your pH is borderline mataas. Yan. So, pag normal to mataas, class, that's a sign of compensation. Okay? So, alkali siya. Tapos, be careful, read the problem first. So, mataas siya. So, most probably, metabolic, diba? So, the arrows are equally going to the same direction. So, metabolic siya. Your bicarbonate class is mataas. Yan. So, fully compensated metabolic Alkalosis. Yan. Ma'am, why fully compensated? Because the pH is already normal. Yan. So as a assistant, so fully compensated. So normal ang pH, mataas ang carbon dioxide, mataas ang bicarbonate. Yan. Ma'am, pag partially compensated, dapat kunyari 7.46 yan, 7.47 yan. Partially compensated yan. Pero mataas pa rin ang PCO2 and bicarbonate. Yan. So kung uncompensated, normal dapat ang carbon dioxide. Okay? Class, I hope that you're getting it. Yan. And I think this is my last problem. A cigarette vendor was brought to the ER of a hospital after she fell into the ground and hurt her leg. She is noted to be tachycardic and tachypneic. Painkillers were carried out to lessen her pain. Suddenly, she started complaining that she is still in pain and now experiencing muscle cramps, tingling, and paresthesia. Measurement of ABGs reveal. So class, from the sound of it, hindi respiratory ang may problema, diba? Parang metabolic. So your pH is 7.6, mataas. Your PCO2 is mababa, 31. So actually, maling sinabi ko. So alkalosis siya, pero the arrows are going to different direction. So class, yung una kong hypothesis, sabi ko parang, tachypneic. So there's something wrong with the lungs ng onte. So yun, sorry. So 7.6 alkalosis siya. So there are going two different direction, yung pH saka PCO2. So metabolic problem. Yung bicarbonate ay mababa. Yan. So the answer is partially compensated respiratory alkalosis. It's partially compensated because class, your bicarbonate is not normal. Yan. Kung normal siya, uncompensated ang kung uncompensated itong sagot natin, dapat normal ang bicarbonate. So partially compensated kasi abnormal pa rin yung pH. But if the pH is close to 7.45, then class, it's fully compensated. So partially compensated respiratory alkalosis. Yan. So your pH is going up, pataas. Tapos, PCO2, mababa. Tapos, your bicarbonate is also low. Okay. Okay, class. So, this is the final part of the discussion. So, we have arterial blood gas test. So, class, practice makes perfect on the different problems. So, arterial blood gas collection. So, how do we do it? So, we collect on your arteries. So, ang tinutusok natin, class, yung mga pulses natin. So, pwedeng sa brachial artery, sa radial artery, class, yan. Sa femoral artery, yan. Ayun. Inguinal artery, pwede rin. So, class, to collect your ABG, actually, we use a syringe. The syringe must be coated with heparin. Yan. Pero class, best pa rin is buy an ABG syringe. So it's already once you buy it, it's already coated with heparin. Class, the problem with you are the one to be manually coating the heparin is you might leave excess amounts of heparin in your syringe. Ayan. Kasi dati, yun ang ginagawa ko, class, manual. Wala tayong ABG syringe eh. So, for brachial artery, what we use is 18 to 120 gauge. The normal angle for your ABG is 45 to 60. So, 90 degrees pag sa femoral artery or sa inguinal artery, class. Yan. Sa inguinal area, sa may singit, yan, class, I tried doing a femoral artery. Yan, and I failed. Next, class. Compress the puncture site quickly, class. It should last up to 3 to 5 minutes. Why? Because this is an artery. It has thicker walls. Hence, class, it's more prone to bleeding out. So you really have to compress it for 3 to 5 minutes. You really have to wait. It's really timed, okay? And expel the air from the syringe. So once you're done collecting it, so place it in water or in ice, which has 1 to 5 degrees Celsius, to minimize the oxygen consumption of your WBC. WBC oxygen consumption. So your leukocytes, class, pag hindi mo ginamitan ng ice, gagamitin ng leukocytes yung yung gases in your arterial blood. Wait, where's my charger? And class, these are our reference ranges. So for our analyzer, class, it uses electrodes. So yung pinadrawing ko sa inyo are your electrodes, your Clark, your Severinghaus. We have silver electrodes. And class, your PO2, PCO2, and pH, they are measured through electrodes. Your bicarbonate, class, it's computed using Henderson-Hasselbalch. Class, Hasselbalch. Pakiano naman yung spelling ko. B-A-C-H ata. Yan, Hasselbalch. Ayun yung H. Yan, Hasselbalch. So, B-A-L-C-H. So, class, when I was working in a hospital, so, actually, my blood gas analysis is a point-of-care testing machine. Yan. So, actually, you can do this on the bedside. You know, class, our ABGs per costing 1,500 ata. Gano'n kamahal yan. At class, pero hindi na 150 yung cost, pero yung unit price, I'm not sure. Pero I have to be careful because this cartridge, this is where I place the blood. So, pag nag-error, I need to do it twice. Ganyan. So, yun, I have to do it carefully and insert it here in this area. Tapos lalabas na yung mga result. Tapos i-record ko na lang. So our hospital was small, so the medical technologist was the one doing ABGs, but I asked my friend in the US. She's a medtech and she works in a big hospital, but medical technologists were the one performing ABGs. Yan. But in some hospitals, class, mostly class, respiratory therapists are the one who perform ABGs. They are the one who perform arterial puncture. Parang may trabaho naman sila, class. So we have partial pressure of oxygen or PO2 measurement. So what we use are Clark electrodes. So meron ako dito. Ayan. Honestly, I don't know what we're looking at. So since it measures O2, so this is where your oxygen permeates. Yan. So once the oxygen is permeate, class, what they measure is the principle is amperometric. Yan. So once there is current, yan. So there's current in your electrode, so that's the indication of your oxygen levels. We also have your Clark electrodes. I was double checking the spelling. Yan. Clark naman, walang E sa huli. Next, we have Severinghaus electrode for the measurement of carbon dioxide. Kung amperometric sa partial pressure of oxygen, sa PCO2 and pH class, it's potentiometric. So, it's not current flow, but ano to? Voltage class, the presence of voltage. So this is the cuvette where your blood is placed. Yan. So this is where your carbon dioxide will enter. Yan. Meron tayong reference electrode. So pang to pH pH eh. Is it raining? Wow, guys, it's raining pero it's sunny. And class, finally, we have pH, so silver electrode, and calomel electrode. So, kalimutan na. Silver, so Ag, and calomel, Hg2Cl2. Yan. So, for your pH electrode, so yan, may silver chloride electrode. May blood sample. So, these are the electrodes. Ayun. So, class, that's it for today. Thank you for listening. Please practice, find other problems regarding acid-base disturbances, okay? Practice whether it's uncompensated, partially compensated, or fully compensated, acid-base disturbances. So class, I'll see you again. Bye-bye.